Now we have a very young patient and she does not have actually almost any signs of aging, but what we see in her is actually skin with large pores, some open and closed comedos, and also some small milia, especially on the cheeks, on the nose and the chin, and also some small inflammatory pimples and pustules. And in this case, that's the reason why I'm going to use the mask peel. First, we clean the skin with Foamer 15. 4 pumps. Applying on the whole face, especially in the areas that are looking a little bit more hyperkeratotic, and leave it for 1 to 2 minutes before removing it. Now we're going to remove it. You can dry it with cotton swabs or with a fan. Now we're going to apply the mask peel. That is a paste. You do not need too much. Just take a little bit. You can apply directly to the face, or you put it first on your one hand and then again starting with the T-zone and distribute it very evenly and slightly. Leave it for about 2 minutes. And then the rest of the material that you have, in order to distribute it a little bit more evenly, you could do it from the beginning as well, distribute on the face. And massage it also a little bit, especially, for example, nose or the chin, where we have some closed mid-desires and comedos and also some inflammatory dimplings. And in order to reduce the discomfort, you can also use a fan and cool down a little bit. And then remove it. Always away from the eyes. We can dry a little bit. And after we have dried, put some moisturizer, for example hyaluronic, that will hydrate the skin, and due to the jojoba oil, a little bit anti-inflammatory and aloe vera as well. The patient should apply sun protection before going out. I usually have my hyaluronic in the refrigerator, so when I apply it, it cools down immediately and even reduce the burning and stinging more than just the cream by itself. For the next time, what you could do, you could apply your mask peel everywhere except cheeks here, and then you would actually could leave it even a little bit longer and reducing the patient's discomfort. And in the patients who are having closed comedos or milia, it's much easier to open and to decapitate the milia, for example, with either the comedo extractor or a 30G needle after you have performed mask peel than without performing it before, and it's even a little bit easier than if you just do the vaporization.
Hello and welcome to New York. Hello and welcome to New Academy's weekly webinar. It is Monday, April the 1st, and I want to welcome you. I'm Pina Lee. We're just going to start in one moment. I'm going to share my slideshow here. For those of you who speak and understand French, we will have the excuse me, subtitles in French for you to be able to read. Hopefully, it does translate properly. I want to welcome everyone today to the future of medical innovation. I trust that everyone can see my slides. If you have any questions, please ask your questions here on chat, and I will do my best to reply as soon as possible. You can also save your questions till the end of the webinar for our Q&A. So I want to welcome you to Nuviewer. Nuviewer is a medical innovation company based in Toronto, Canada. We are fast growing and growing every day. We bring new technology and medical solutions as devices to North America. We harness that global way of thinking. We bring the most innovative ideas, technologies, and methods to our Canadian clients and American clients to help them grow and sustain their business. Meet our brands. We are so proud to pair up with the world's best. First of all, five-time AMWC Congress winners of the suspension thread lifts is Aptos. We are anxiously awaiting Health Canada approval for our thread lift methods. And believe me, I will be shouting it from all rooftops when it does become Health Canada approved. In the meantime, we do have our Fedia high tissue PRP device. It is an amazing device that gives you safe, precise, high concentration of platelet rich plasma for your clients in a disposable, affordable, and easy to use system. It too is an award winner at the Aesthetic Medical World Congress, and we are so proud to offer it to you. Of course, when it comes to medical devices, we have our Fedia PRP, but we do want to support you for all your medical supply needs. At Nuviewer, we have thousands of SKUs to support your practice or business. We also price match. And if there is any item that you're looking to purchase and don't see it on our website, please reach out to one of the Nuviewer members and we will assist you and try to source it out for you. Our brands our dermaceutic laboratory, an amazing medical grade line developed by the fascinating minds of those French dermatologists who came together to create Dermaceutic Laboratory, number one chemical peel brand in France. And they have a quality line that enhances and supports any and all medical aesthetic treatments that you provide. It will support your existing treatments and solutions with skin preparation products, immediate post-procedure products, as well as that post-treatment time for support. And who we're talking about today, Mesoaesthetic, a medical grade line that comes from the market leader in the field of medical cosmetics, committed to providing the most effective solutions for all skin types and concerns, created and backed in science. And of course, I'm Pina Lee, your clinical educator. I have over 25 years of experience in the industry, from teaching to providing services in the professional and the medical field. But above all, I'm here to empower you. I want you to have all the knowledge and confidence in Nubior products for your success. Today, we will be talking about acnelan, a medical solution to the acne situations in our world. So this is a treatment that you do require a medical director for. If you do not have a medical director, but still would like some help with the patients, please let me know after our webinar today, and I can happily guide you with some solutions. Now, before we discuss the amazing results and techniques of acnelan, I do want to review. Now, acne is a very complex skin condition that is very prevalent in young adults, especially under the age of 25. We associate acne with puberty, and rightly so. But there is 30% of adults that also deal with acne. It is not just that trauma of the teenage years. And there is a number of factors that can trigger or contribute to that acne condition, including your diet. If you're eating processed and highly sugared and fatty foods with lots of salts, it is going to affect how your body deals with this issue. Certain medications we take can cause or add to the issue of acne. And of course, stress. You can't prepare for a beautiful occasion or a scary time of life, getting ready for something you're anxious about without looking down on your face and in your complexion, seeing a new friend. Stress and acne go hand in hand. And of course, our body doesn't recognize that you're getting ready for your wedding or getting ready for your prom or a big job interview. It just knows stress, and it will contribute to acne lesions. One of the big things that most people don't realize, our cosmetics can cause and contribute to the conditions that make acne possible, especially with blush and foundations, whether it's not the right one for your skin, whether you're not removing it, or whether it is a very poor quality. This is another contributing factor to acne. And hormone fluctuation, which is one of the big reasons, because when we hit puberty, our hormone levels change. whether you live in a climate too that is too dry or too humid, will also affect your acne condition. And of course, genetics. Our DNA is programmed. So if your parents or your grandparents or your uncles and aunts suffered with it, there are greater chances that you will too. And our emotions, our body and our psyche are attached. So all of these different factors and triggers can contribute to the degree and the severity of acne. Acne is an inflammatory skin issue. It involves different processes of that sebaceous gland of our skin cells. So it is in the skin, even though it's connected to our body, our digestive system, our nervous system, our hormonal systems, but it is produced in the skin, in those sebaceous glands. On the skin, it will appear in many ways from different grades of acne. And whether it's just congestion or deep cysts and nodules, it has an emotional and a social impact on those that are afflicted with acne. It is not just a physical condition of the skin. And myself being in this industry, I understand the impact that it can have on you. For this is the reason why I myself became an esthetician way back when. I broke out of nowhere in my mid-20s, and I tried everything to get on top of it, not knowing, and became an esthetician. And I only wish I had acnelan back in that time. But fortunately enough for you and your clients, we do have acnelan now. Now, here is some visual images for you to understand that process of acne. Basically, there is hyperseborrhea, which is an overproduction of seborrheic oil or oil from that sebaceous gland, and there's an imbalance. When too much oil is being made, it can get backed up. Then you bring into this factor of the skin cells. That skin cell at the surface of that epidermis, the more that skin produces, the more keratinized cells that lay on that surface of the skin. And with that amount of keratinized skin, it can block those beautiful hair follicles that contain those sebaceous factories that create that oil. That oil is necessary to keep our hair and our skin moist and conditioned. It protects us from the environment and the elements. So the oil that our skin creates is vital for healthy skin and a healthy skin barrier. But when there's too much oil, too much skin, then it becomes blocked. And that's when that slippery slope happens and inflammation occurs. So now we have an inflammatory effect happening here. There is a blockage. Once there is that blockage, oxygen can no longer enter into that follicle. And in the absence of oxygen, that P. acne bacteria can now flourish. So now there is bacteria involved. So here is that pathological process in words. And if you do want to use any of these slides for educating your patients and clinic clients, these are great slides. Here we talk about that response, that testosterone hormone elevates, especially in puberty. And we get those sex hormones flushing through our body. It brings oil to our sebaceous glands, smells to our teenagers, as well as secondary hair in those different body parts. But when there is too much androgen, that is when you're going to make that sebum. That is when that skin is going to go into overdrive. And that's when that follicle can get clogged, leading to that inflammation, which leads to that bacterial creation. And at the end of the day, it's acne. And with acne comes pigmentation and scarring as well. Yes. Definitely, we can definitely help you with slides. If you need anything for lunch and learns or for clients, just reach out to myself or to your rep and we'll definitely help you. Now, what I love about acnelan, this is not a treatment, even though it's a medical treatment, it's not a treatment that you have to save and reserve just for those clients with inflammatory acne. This is why I love acnelan. You can save the suffering of so many skins if you start treating it right here in that congestion stage, when those follicles are first being blocked, and even in your teenagers with that first sign of bumpy skin, blackheads, or open comedones and closed comedones, whiteheads. So when they have that follicular hyperkeratinization, that's a great time to start. So think of your clients with ingrown hairs in that beard or neck area, even behind the neck, chest and back acne, or for, I'm saying, those first signs of puberty when they are congested. Get them on then and save them from getting into that inflammatory acne. Of course, grade 1 has those open and closed comedones. Yes, you might have the occasional papule, but this is the skin that you see a lot in that skin that has a lot of buildup. Beautiful with that first grade mild non-inflammatory acne, as well as grade 2, which will have more papules, occasional pustules. We call that your moderate acne. Still not inflammatory. You do have some redness or lesions. But when we get into grade 3 and 4, that's when we're talking about that inflamed pustules, nodules, cysts. And when it gets into that grade 4, when it's now affecting that dermal layer of the skin, there are more severe chances of scarring. So any level of acne, and as they call this one, grade 0 congested skin acne, you can offer a safe and beautiful solution. And as I said, I'm a skin type 4. When you treat me, my skin reacts like a skin type 1, so I get red and fiery. And when I heal like a skin type 5, 6, scarring and pigmenting. So when I suffered through acne, I had to suffer through the months and months of pigmentation and scarring, which I'm still repairing. So with acnelan, you will help those clients stay away from that aftermath of acne, prevent those scars, prevent that post-inflammatory hyperpigmentation, PIH, that so many high photo skin types suffer with. Now, when you are looking at the world of treating acne, there are many solutions. And we're not saying that acnelan is the only one, but what we are saying is it is safe, it is easy, it is effective. cost effective for your client and your clinic, and it is a short-term treatment option without a lot of downtime and definitely free of pain. So that is why a topical treatment like acnelan is so popular with patients with acne, as opposed to that physical treatment of squeezing and extracting, as opposed to those light-based treatments that a lot of skins can be contraindicated to. And when you're dealing with giving a young person or any person a medical drug like isotretinoids, Accutane, better known as, and its other names out there. That's a serious drug with serious concerns. They need to go on blood tests to make sure that there's no damage to their organs. And there's so many aftermaths to being on a drug as powerful as that when it comes to the condition of the skin. And of course, antibiotics is a short-term band-aid effects. Yes, it does help with kickstarting, taking care of that bacteria. But a topical treatment like acnelan will give that client the results they want without that major commitment, without that pain, and without worrying about the aftermath. When you're talking about most treatments out there, they deal with the problem. You see a doctor, they give you the creams, it dries out your face, but it gets rid of your acne. Mesoaesthetic wants a different approach. They want to, yes, avoid those lesions, but we also want to make sure that that skin post acne is beautiful as well. We want that client to be able to hold their head up high, improve their self-esteem. And for this reason, we are going to approach acne with a multifocal approach, consistent treatments, and start that treatment, the first signs of those symptoms, that first congestion, rather than waiting till we're chasing the problem. Get ahead of it. And with that is the acnelan method. This is what the acnelan pack looks like. Professional series of treatments, 3 in a package. And of course, like everything, it's not a magic wand. You need to support it with the home protocol. So it is a comprehensive approach from mesoaesthetic for all grades of acne and for all photo skin types. That gives you an intensive in-office treatment as well. It is supported by a range of amazing home care products. So what specifically will acnelan do? First of all, it's going to control that production of oil to ensure that there is not a hypersebaceous routine going on in the skin. We're going to regulate the amount of skin, that hyperkeratinization process, the surface of the skin. We're going to clear out those sebaceous follicles, and we're going to control that inflammatory response, bringing down that inflammation and redness of those lesions. We are going to ensure that we reduce that post-acne scar, and we're going to control that bacteria as well as inhibit tyrosinase. So we're going to reduce the risk of hyperpigmentation post-acne. How does mesoaesthetic do it? We do it with our beautiful complex called our M-Acne complex, and it's exclusive to mesoaesthetic and the supporting products. It is with salicylic acid, mandelic acid, and personally, I think these two are best friends. They work gorgeous together. That also includes shikemic acid, as well as your sodium lipargenate. Now, salsa, as we know, is a BHA. It is an anti-inflammatory as well as an antimicrobial. So it's going to help with that, supporting that sebaceous gland, regulating that oil production, killing that bacteria. It does give us exfoliation. And because it is oil loving, it can get into those follicles. Pair it up with its best friend, mandelic. Now, I'm just spreading rumors. I don't know if they're best friends, but they really should be, because mandelic and salicylic work beautifully together. Mandelic, I love for that sensitive skin. It's a larger molecule, so it doesn't exfoliate as deeply as, say, a lactic or a glycolic molecule. It is gentle enough for that sensitized skin, or that skin that is dealing with more redness. It calms, it soothes, it too helps with that inflammation. Shikimic acid, you've heard me speak about shikimic before. It is a beautiful acid that helps our cells live longer and work better. Bring in that sodium lipargenate, which I hear rumors is a derivative of azelaic acid. And again, bringing down that inflammation, helping with getting rid of all the factors of acne. Now, in vitro, this is where mesoaesthetic always shines, because they always have that medical and science support for every treatment and product they produce. And as you can see here, with our studies, we have shown that with our M acne complex, we see a 90% reduction of that swelling of those lesions and that flushing of that lesion. With melanin synthesis, because every time you get a acne lesion, for many of us, we're left with that pigmentation. So with acnelan, we're seeing a 40% control, a reduction in that melanin synthesis, because we are inhibiting trisinase. So again, just to recap what we're going to do, we're going to correct and we're going to regulate. We're going to reduce inflammation. We're going to get rid of that redness, those visible lesions of acne. We're going to control that production of that bacteria, key acne bacteria, and we're going to regulate that sebum production and block those sebaceous canals, renewing that skin by desquamation and keratinization, and of course, inhibiting that trisinase. So you can see it's a complete and multifocal approach to all the symptoms of acne. And this is what it looks like. Within that kit, you're going to get 3 treatments for a client. That is how they've designed it. You can do a treatment for each client and have many boxes, whatever you want. In that treatment box, you will have your acnelan multi-factor mask. Now, this is an in-office treatment, so you will apply the entire contents of 1 jar to your client's treatment area. In this beautiful mask, it is kaolin based, so it is clay. It does have our acne complex that's going to stimulate and facilitate that exfoliation, control that sebum production, kill that bacteria, and reduce that redness. But it also has beautiful ingredients for that hyperkeratinization and making sure it all regulates. It is at pH of 3.5, but it is capable of frosting that skin. So ensure that you monitor and use that protocol properly. And the application exposure time is very minimal, 2 minutes. Once the mask has done its intensive treatment, you are going to neutralize it with our post-peel neutralizing spray. Now, I know everyone has a neutralizer, but Mesoaesthetics post-peel neutralizing spray not only gives you that neutralizing action of your sodium bicarbonate, it has an amazing aloe vera extract that is going to help with the soothing and moisturizing of that post-peel skin. I love it for all my treatments. You can buy it on its own. It is available outside of the acnelan treatment kit. So stock up for any of your heels that need a neutralizer that you would like to add some additional soothing and moisturizing to. Once you have neutralized that face, it is now time to apply the pore sealing shields. And this is a gorgeous little clear solution that is applied to the entire treatment area, contains zinc as well as copper and aloe vera. So we're going to reduce inflammation, soothe, help restore that barrier, and keep that skin protected by its shield. The beauty of it that it has a re-screwable cap. So if the skin can absorb the entire 3 ml vial, you can send it home with the client. So very simple, very straightforward treatment, and the results are beautiful. There is very minimal downtime for those first 42, 48 hours. Of course, they are recovering from a peel. So you want to stay cool, calm, and collected. You don't want to be doing any extreme exercises or inducing heat in that treatment area. So just take it easy for a couple of days. And then you can start your whole protocol, because you do need to remember mesoaesthetic is absolutely amazing and scandalous with its results, but it is not a magic wand. It does require support from your patient at home. I do suggest getting them ready first so their treatments are more effective. Get them on a good cleanser, a good treatment cream, and of course, sunscreen to get that skin ready for treatment. This line has been improved, and with the prompting of Health Canada, you will have seen a big change in the acne control products from Mesoaesthetic. First things first, it is going to be called Millennider. Now, our purifying mousse is still as beautiful as always. It is a gorgeous cleanser that we have in our home, that it is a pumping foam. So beautiful for delivery. It purifies that skin. It removes dead skin from the surface, refines the texture of the skin. It does have our patented urban detox, our anti-pollution acne, because we do live in the 2024 and you can't get away from pollution. But we also have protection for that barrier. It has salicylic and lactic acid, which I love, to help with hydrating that skin, and with the urea to moisturize. Can be used up to twice a day. Now, Acne One, for those of you who loved it, and I know you'll miss it, but you will be happily pleased to bring in Belemiderm treatment. This replaces our Acne One. So this is your active ingredients for that inflammatory acne, for the grades 3 and 4. I love for active acne. Definitely Belemiderm treatment is the one. It has azelaic acid, it has shikemic, and it is a beautiful treatment cream that they will use every night on active acne. So for that severe and moderate severe acne. For that oily skin, that congested skin that's just getting to that slippery slope of acne, we have our Derm Resurfacing Gel. Now, some of you might be familiar with our Resurfacing Peel Booster that is still beautiful. But we have our Derm Resurfacing Gel. I love this for day use. I love this for skins that don't have a lot of acne, but they are oily and acne prone. I also love this for an oily skin who just needs to resurface with the glycolic, with the salicylic. It has also your beautiful exfoliating and antioxidants in the gluconolactone. And this can be used for, like I said, those oily, prone skins. And to replace our imperfection control, we now have our local control by Derm. Now, please remember, just like our imperfection control, Derm local control is specifically intended for inflamed lesions. So your papules and pustules that are inflamed. You will not use this on your comedones or melias. This is just for an inflamed lesion, and you are just going to put a very tiny amount specifically on that lesion, and it will bring it down. It does contain pigments to help conceal the area, but it has got quick acting ingredients to bring down that lesion right in that skin tone. Of course, anyone that is using actives for the treatment of acne or acne prone skin, hydration is vital. And I know I make enough oil, blah, blah, blah. You still need hydration. When your body gets unbalanced and it doesn't have enough water, it will produce more oil. So do yourself a favor. Your skin will thank you. Add some hydration to your everyday. I love, love, love Hydrovital Light for any skin that is oily, acne prone, or just doesn't want a heavy hydrating cream. Hydrovital Light is a beautiful gel-based cream that is going to give you hydration. It is going to give you deep hydration to get you with softer skin without a heavy feel. Morning and night over your actives, it's a gorgeous cream. And of course, when you're prepping that skin for their series or they've completed their series, the Pure Renewing Mask is a awesome treatment for home, but in the back bar, it is fantastic. If you do offer a teen facial, a oily skin facial, an extraction type facial, use this in back bar. Use it as a mask before you do your extractions. Put it under steam for the last few minutes. Add your fingers with some water, and now it's a scrub. Beautiful for facilitating extractions at home. They can use it up to twice a week. They're going to leave it on for 5 to 10 minutes. Now, having firsthand experiences with acne as an acne sufferer, I hated doing things at home because the scrubbing and the pulling would hurt my grade 4 acne. But this is gorgeous because you can use it just as a mask that you can moisten off. for those inflamed skins. But for those skins with grade 1 or 2 and have a lot of congestion, blackheads, or just oil stuck in their pores, after they leave this on their face for 5 or 10 minutes, they can then add water. The texture will change. And with some gentle friction with their wet finger pads, it now becomes a scrub, as it has some beautiful cellulose, plant fibers that work like a friction scrub. So in office, beautiful on the back bar, at home, a gorgeous once to twice a week treatment mask and scrub. Of course, there is a series when you're dealing with acne, because again, no magic wand here. For most of your acne sufferers, 3 sessions will be a series, and why it comes in a pack of 3. You will space their treatments a minimum of 14 days apart. With most people and sensitive skins, you can go 21 days. So listen to that skin. If the skin is still recovering, it's still not quite ready to be knocked down again, it's not a race. So 14 is the minimum, 21 is the average, based on that skin sensitivity and, of course, the resilience of that skin. Now, when you're talking about the amount of treatments, 1 or 2 treatments is not enough to normalize that sebaceous glands activity. That's why we say 3 is that magic number. Now, for that mild to moderate, grade 2, grade 3 acne, 5 sessions would be way too much. 3 is that number. But if you have a rebellious case of acne, then perhaps 2 series of 3, so you'll have 6 complete treatments, would be more appropriate. But for most, it's 3 treatments. So they would go home first, start with some products to get that skin ready, do your treatment, wait a couple of days before they start introducing actives, but use your hydrator and cleansers, and then your actives in between. So 3 sessions is the magic number. And when you're talking your home treatment, you're going to cleanse, you're going to choose the appropriate item or items for yourself. I know many skins that use the Derm treatment at night and the resurfacing during the day. And of course, always follow it up with your hydrator and a good protection. And then for your localized treatment, you can use as you need to spot treat with our Derm local control. So these are the gorgeous treatment and its supporting products. And these are the results. Just after 1 treatment, you can see a significant improvement in the redness and the texture of that skin. Here you can see that hormonal and stress-induced acne after 3 sessions combined with her home use, getting gorgeous results. Doesn't matter the skin type, color, it is beautiful on that skin 4, 5, and 6, because there is so much risk when it comes to the chemical peel. There may be changes in their pigmentation right after, but that skin will heal gorgeous. And of course, reducing those post-acne scars, eliminating the risk of hyperpigmentation, improving the texture of the skin, and giving that client the they need for their self-esteem. So why acnelan? Because it is the medical solution to acne. It's a comprehensive solution that addresses all those multifaceted challenges of acne and its effect on the skin. its synergistic patterns are combined to work effectively and efficiently on that skin. It is safe for all photo skin types and all grades of acne, including your congested skin. And with your guidance and their home products, your treatments, they will have beautiful results that are backed in science. So that is acnelan. I am proud to share it with you. And for joining us today, as a thank you, use this access code that we no longer have our webinar surveys, but I would love to hear your feedback on our surveys, so please share them with me. But if you are going to purchase acnelan this week, you will receive 50% off your order for acnelan with this code. And that code will be used for this week only. So on our next week's seminar, this code will no longer be valid. So if you do want to take advantage and save $50 off a pack, please do so. Also, I do want to say for all of you who are a clinic partner, whether you own the clinic or work at the clinic, start your own personal account with Nuvior, and you will receive 20% off clinic pricing for retail products for your personal use. That way you can enjoy the products as much as we do. And we are constantly growing. So if you know anyone that is ready to join our team, please tell me about them. Tell Sophia about them, our lead. Send your CV or resume to HR@Nuvior. And of course, I'm Pina Lee. If you need me, reach out. Find me on our website. Send me an email, text me, phone me, or WhatsApp me at my number, and I'm always here to help you. And I do see that we have a question. How many minutes should the clinical acne plan stay on the skin? Yes. So acnelan, once you put it on the skin, it stays on the face for 2 minutes. If the skin, it's their first treatment, they're a darker skin type, listen to the skin. If they can't handle it, you can neutralize it before that. Some doctors will go up to 3 to 4 minutes, but again, listen to the skin. Don't do that on your first treatment. That is something you would build up to if necessary. 2 minutes is that magic number. So as soon as you apply, start clocking for 2 minutes. Any other questions or comments? Oh, you are so welcome. Please take advantage of our promo. Use that Acne 50 PINA so you too can get 50% off of your purchases for this week only. It has now come to the time to say goodbye. I want to thank everyone for joining us here today. As I said, if you have any questions, please reach out. I am always here to support. And I want to thank you all for joining, and we'll see you again next Monday at 12 p.m. Eastern Daylight Savings Time now for another edition of our new Academy weekly webinar. Have a great Monday and enjoy your